This is the Bottom Line Liberia. Join us on Facebook, YouTube and online radio. This is the Bottom Line Liberia. Join us on Facebook, YouTube and online radio.
Well, we like to say welcome to the Bottom Line Liberia, and this is where we'll discuss the issues and give our views. Tonight it's going to be very interesting because we're going to have guests here tonight, and the guests will be discussing medical issues. I guess my colleagues are all settled in the background, and we have our guests as well. But before then, we'll be going through some little discussions concerning major headlines in Liberia. But I want to say welcome to Ichima, and from there we'll be going into our team music.
Yes, thank you. Thank you, Limbo. Thanks for tonight. Going to be quite interesting. We have two senior Liberian trained medical doctors will be our guests tonight on the show, and Limbo will be taking over too. And I know, Limbo, I'm excited. You know, we have professional people tonight on our show to discuss Liberia healthcare system, which should be one of the elements in Liberia, and also I'm quite excited to have them here to share their thoughts with us.
Well, you know, I remember the last show we had on on Tuesday. Our guest made a comment. He said, he was happy to be on the show, but the only disappointment was we do not have ladies or gentlemen. And I told you, no, we do have ladies on the show. And so tonight we like to say welcome to our sister Cora Tracy. Cora, welcome, and tell us how you've been doing.
I've been doing well. Thank you all so much. I missed the show, and I've been busy these few days. We've been building home, but we're still building, not done yet. So yeah, just glad to be back.
Okay, so it's good to have everybody back. We hope Paul is going to be joining us pretty soon, along with Francis and the rest of the hosts. So Paul took it from more. Paul, welcome. You are mute, Paul. You are mute.
Hold on. Good evening, guys. The only female house. Good evening. Long time. Haven't seen you guys. What's going on?
Well, everything is okay, and we hope to have a very, very good discussion tonight, as well as we have our guests coming. But before the guests come, we're going to take this short musical break, and right after that, we'll come back with our guests. And while the musical break is on, we ask that you all share the show, do something joining us.
My people, where you at? Where you at? Wake up from your slumber, stop sleeping. Whip your hands, whip your hands, whip your hands, whip your. Come on, come on, come on. I know you're sleeping now. Y'all gotta wake up some more, yeah? Okay, let's go. The people fool us. The people lie to us. The government betray us. So much. I said they lie. The people fool us. The people lie to us. The government betray us. They can lie, they can steal, they will not go. I said we tired with their lies. We tired with their promises that led us to a lot of damages. We tired with that speech they preach in DNA unique, they deceive us. The thing we saw, it frustrate us. So why did you lie? Why did you steal? Why did you allow the citizens to beat? You see, we just tell you that why we voted you. But you fool us, you screw us, you use us and later on abuse us. So why? The government should lie. Why? But that's the question that we ask. The people fool us. The people lie to us. The government betray us. So much. I said they lie. The people fool us, the people lie to us, the government betray us. They can lie, they can steal, they go knock the corrupt. I said no one to trust. My people don't want to hope on. Nobody. My hope that I have been broken. I'm telling you, brother. So where are the schools? Where are the roads? Where are the jobs that they say they could afford? But they're too selfish. The people tired with their rhetoric. People tired, they tired. You see the reason why we ask why the government betray. They have enough for time, but yeah, then stay they delay. People suffer. No work for people crying for hunger. Look at. Your vision and your mission, your intention to the nation, they poor. You got nothing to show. Nothing. So, why? The government should lie. Why? But that's the question that we ask. They lie. The people fool us. The people lie to us. The government betray us. They betray us. They lie. The people fool us, the people lie to us, the government betray us. They can lie, they can steal, they go knock them for us. We tired with their promises that left us to all our damages. We tired with that speech they preach indeed, and now unique they deceive us. The thing we saw it frustrate us. So why can you lie? Why can you steal? Why can you allow the citizens to breathe? You see, we just tell you that why we both tell you. But you fool us. You screw us, you use us and later on abuse us. So why? The government should lie. Why? But that's the question that we ask. The people fool us. The people lie to us. The government betray us. They betray us. So I said they lie.
Through trials and tribulations, you have prevailed. Your spirit is unbreakable, never derailed. With a rich heritage and culture in grace, Liberia, you are the land where you grace.
You are welcome to the Bottom Line Liberia.
And yes, indeed, you are welcome to the Bottom Line Liberia. Tonight, like I said, we have a house full of guests as well as producers. Paul the Lord is well seated there in London, while Jima Kamara is in Manchester, the land of football, or the city of football. And I am in the Vikings land. But of course, our sister is there is it Holland?
Yeah.
Good. So, there's a story about Holland, the Netherlands. In Norwegian, it means honor land. So they say your town is underground town, honor land town. What do you know about that?
It's below sea level. The Netherlands is below sea level, so if the sea rises, then we're gonna get.
Okay.
Yeah.
and I saw something on Facebook. They say in the Netherlands there's a town, there's a city somewhere in between Netherlands and Belgium. So the capital city, that city is on the border. So one house, the house is there, people sleeping in the other room, they are in Netherlands, the other people in Holland.
Yeah,
well, that's interesting. Yeah, that's interesting. That's just a little bit of history. So let's say welcome to you, gentlemen. Paul, Jima, where do we start from?
Yeah, we just wanted I think we got some hosts of panelists joining us tonight. I think we'll go straight to, not to waste our guest time. We've got two professionals, trained medical doctors that are guests tonight and going to take us through the Liberian healthcare system, the delivery system. And I think we should go straight to them. You bring them on and let's have some conversation.
Okay. Well, just before we bring on the doctors, we want to hear a little bit from our sister and Paul, and then we can set the stage now rolling. Go. You see,
what do you want to hear?
When women will say no, let men go first.
Oh, okay. What do you guys want to hear?
No, nothing. Anything on your mind, probably.
Oh, I'm just glad to be here tonight and to be a part of this great conversation. So
Great.
I'm excited to be here.
Mm-hmm.
I'm looking forward to a great and fruitful conversation tonight.
Okay. Paul?
I'm always happy to be back. I want to say good evening to you all and good evening to our listening audience. It's good to be back on the bottom line, and I'm looking forward to the discussion. Before we get into the discussion, you're talking about Holland. Holland is my birth country. So just to let you know, that's my first country in Western Europe that I entered. So they gave me birth. So when you're talking about the native land, count me as the pioneer of that place before Jeremiah and others even went to Holland. So just
really?
Yeah, he went to Russia
nice.
to learn how to.
He went to put
also say when
he went to Russia to go learn how to make bombs. So the government
I mean, don't make yourself back and people want to visit Liberia for them to chase me out, please.
So we spend a lot in Liberia because they are trained how to make bombs.
I traveled with Belgian Airlines to Europe for the first time. So was it?
We know they're by name, so don't worry.
So no. I think it was Sabina. So my first country I was learning Europe, that was the place. And guess what? In a flight between that place and Sweden, the cloud was so much you can't see the ground. So in my mind, my first time, so I thought that cloud that on the ground, you can get there and walk. So but let's say welcome to Pataki, our name from Belgium, and Holland as well. He's also in Holland and from Belgium at the same time. But please help us to share the show, Honest Eastman, Honest Sherman, that is. Help us to share the show. Okay, guys, we're going to be talking to the doctors. And I want us to bear in mind that we are talking to professional doctors. And those are doctors that only work in the medical field. They have no control or access to or over the Ministry of Education, the policy-making wing of the government that takes care of health activity, which is the Ministry of Education, Ministry of Health. So when we're asking in our questions, we shouldn't put them in a situation like they are authorities from the Ministry of Health. So we can border our questions on how what can be done, how they see the pandemic or whatever. And so I just want us to set that stage. But let's say welcome to God to me. He's coming on also. But Chimaso, if our guests are ready, we can bring them on.
Yeah, let me see if the guests are ready. Let me see Dr. Mulbah, Dr. Lah. Let me see if they're
I see Dr. Lah in the bike, I think.
Yeah, I think, like a couple of minutes to get us here ready. Once they're ready to signal us, we'll let them in. But in the meantime, I think Guy is also coming on. And just to let you know, we also live on the radio as well. We have a Bottom Library Radio Live 247. You can catch us live. You get the apps, download the apps. You can catch us there for the YouTube, Facebook as well, and our live radio. So you can also listen to us there if you don't have the opportunity to watch us on video. Let me see if our guest is ready. I think Dr. Mulbah and Dr. Let me see. They are not ready yet. But in the meantime, let's until the signals when they're ready. So the doctor's in now. Dr. Mulbah is in.
And I see God to me in the bad if God is set. God just brought you on. Are you set?
Yes. Let me say a pleasant good evening to all of you, the wonderful people of Borderline Liberia. And let me also say a pleasant welcome to our guest. And I see one of them is in studio. Let me say welcome to you. And folks, if you're there in Radio Land, if you're listening via our online radio, I'm here seated in Niedersachsen, Germany, precisely Pioneer, and I'm here live carrying it on the radio, so you can monitor our radio as well and catch up with everything. Thank you, guys.
Thank you so much, God. Let's say welcome to Dr. Emmanuel Lah and Dr. David Dulu Mulbah. We are happy to have you here on the Bottom Line Liberia. We have Jima Kamara in studio there in London. We have Paul the Lord Children. Jima is in Manchester. Paul is in London. Our sister Kuro is in the Netherlands, and Gakim is in Germany, and I am Linford Goa here in Norway. We want to say welcome to you. This is what we do here. We discuss the issues, we give our views, and we do it respectively or with respect. That is, we do not go after our personalities. We do not, we may disagree on the discussions, on the topics, because we all do not think the same way, but we do it with respect. So welcome, and we will start with Dr. Dr. La, okay. Dr. La, I understand you are in the UK. Do you hear me well?
Hello, yeah, I can hear you well. Yeah.
Okay, I understand you are in the UK. How you doing, and how is everything?
Yeah, good evening to everyone and good evening to your listening audience. I'm feeling good and I'm happy to be on your show this evening, and I hope that we can have a very positive discussion to uplift Liberia.
Do doctors get sick?
Doctors do get sick. As a matter of fact, I even have otitis media. My ear just started hurting me yesterday, but I've taken some medications and I think I feel good. I'm ready for the
You
show.
see, there's a reason why I asked the question, because when the doctor gets sick, we not doctor now, then we will treat the doctor for. Dr. Mulbah, you too, welcome. How are you doing?
Yeah, so thank you to Borderline for having me. I am good. So it's a pleasure to be here, and I look forward to a very fruitful discussion on how we can be able to improve our health sector to improve quality of care to our people. So I'm happy to be here tonight.
Okay. We'll get the ball rolling. Thank you so much. We do not have a particular format. We just discuss the issues as they unfold of the discussions. Dr. Mulbah, you talk about, the improvement of our healthcare delivery system, especially that is in Liberia. For those of you listening to us, we are all Liberians here, and we are based in Europe, and so this is a European platform. So, Dr. Mulbah, where do you see the actual need? Which part of our health sector do you see the actual need for improvement? Is it the overall health sector, or is there a specific sector in the health that you think will be improved? Let us start it like that.
So basically, I would say almost every aspect of this sector needs some level of improvement. Some areas might be maybe 10% improvement. Some area might be 50%. Some area might be 60%. So generally, as a country, we are not where we want to be when it comes to providing health services to our people. If even you look at our patient to doctors ratio, the standard from WHO says one doctor to about like 1,000 or 2,000 or even up to 4,000. But Liberia, if you look at our ratio right now, it's one doctor to almost about 10,000 persons. So that the gap is so wide. So even in terms of personnel, in terms of infrastructure, in terms of the distances from the health facilities of healthcare areas to where patients have to come, basically almost everywhere needs improvement. And even when it comes to the number of specialties we have in our country, still we cannot be able to match the number of doctors with that of the population. And this get worse when you leave from the capital to rural areas. It is a bit better off in Monrovia as compared to leeward counties. Like for me, I'm in Nimba. I've been in Nimba now for December will make me to where I am about 3 years, and I can tell you it has been challenging. It requires commitment. It requires dedication, because on so many occasions, patients will be there, and you just have to do what you can do. Because even getting the patients from here to Monrovia if maybe like for my place we have only one ambulance, this one ambulance have to attend to almost 50, 60,000 persons you're talking about, and you cannot be able to share the one ambulance between these people. Sometimes even the will from also the patients. Some of the patients cannot be able to afford the cost of healthcare in the capital. So even referring them from here to sometime to the capital, it is difficult. Some parents will tell you that they prefer to stay and revert to traditional medicine or other forms that they can be able to seek care. So basically, what I want to say is that almost every aspect of this sector needs improvement.
Okay, guys, we have a host of hosts here. So what we'll do is we'll go, we'll leave it to, or limit it to 2 questions per person now. So I just asked my first question. So let me ask my second question, and then after Chima, we'll go to our sister, Cora. Then after Cora, Paul, and then we'll go to Guy, and then we'll go to Francis. We try to do it, orderly. You can ask 2 questions, but if you do not have 2 questions, you have one at a time now. You can do that. So, but doctor, you mentioned that the population overwhelms the manpower we have in terms of doctors. Is it because we got so many people more than the number of doctors we have in Liberia, or is it that they are not just doctors willing to work? What's the problem? Why are you doctors overwhelmed by the sick people?
So as of this year, I think the total number of doctors in this country is 500, maybe between 510 or 500. It is not more than 510 doctors. And if you should divide this number by about 5 million persons, because the recent census placed Liberia around 5 million or 4 point something million persons. If you took about almost one doctor to about 9,000 plus almost approximately 10,000 persons to a doctor. So if you look at this number, and though we agree that bulk of the Liberian population will be centered in Monrovia and its environs, and maybe few populated counties, the Bon, Nimba, and so on. So the farther you leave from Monrovia to the rural areas, you notice that the number of doctors reduce. To my facility where I am, initially we were only 2 doctors here. The ministry this year, I was opportune that another doctor was added to me, so now we have a 3. I got a catchment population of almost 28,000 persons, and you got 3 doctors. We are offering all of the services. I'm staying my shop because I just had surgery this evening before we went into the show. So we running all of the services, and it is not only unique to the doctors. Almost all the other categories of health, they are also, this problem is also there. My facility right now, I got 10 nurses. 10 nurses to be able to cater to, we're talking about 28, 30,000 persons. So there's the issue about on staff. It is not only unique to the doctors, it also applies to the nurses, it applies to the PAs, the laboratory technicians, and so on. So the personnel, when it comes to health, it is a problem that the ministry needs to look at that and see how best it can be handled.
Okay. Chima?
Yeah, before I go on, I think somebody has a monitor on disrupting. There's a disruption sign. If you have your radio or TV on, could you lower it, please? There's a noise in the background.
There is somebody monitoring something. So
because if you have your radio on, please turn it low. Right. My question is just straight to the doctor. Dr. Emmanuel Lah and Dr. Mulbah, please welcome. I'm just quite interested in their background. If they can go around, tell her what their profession is, what they specialize in, the area they study education-wise. That's what I'm quite interested in before. I think the listeners want to know more, then I'll give my second question. If you want, any doctor can take for Dr. Emmanuel Lah.
Yeah, good evening
So I
to
think
your
there's a lot
listening
more I've
audience.
been talking, so you can go.
Yeah, good evening to your listening audience. So, my name is Dr. Lah, and interestingly, I'm a Liberian doctor. I was trained at the AMW College of Medicine. I did my first degree in biology at Cottington University and graduated in 2012. And then I wrote the medical school entrance. And as a matter of fact, Liberia has got just one medical school, the AMWT, which is our alma mater. And then I was able to go through my medical studies for 5 years and then did a 1 year rotation, which we call the internship in 4 departments. That's surgery, pediatrics, obstetric and gyne, and internal medicine. And afterwards, I had to do what we call the EMOC, where they train doctors to do some basic, to get some basic surgical skills. Because in Liberia, after your training, the system is that you'll be posted in the rural area. And once you are posted in the rural area, you become literally jack of all trades. You have to do surgery, you have to do obstetric surgeries and stuff like that. And so the facility that Dr. Mulbah is currently serving are the ministry posted me there in 2021 as a rural doctor. I worked there for a year, Saklipi Comprehensive Medical Center. And then at the end of that year, I had the opportunity to come for further studies. So, yeah, I'm hoping to specialize in pediatric surgery, which I haven't started yet. Yeah, but there are other trainings and other studies that I'm currently doing. And in due time, I think the library people will know that. Yeah, so that's just basically Dr. Lah for you. But before Dr. Mulbah comes on, I just want to say a big congratulations to doctors that graduated today. We have a lot of specialties, doctors that graduated last week. Some graduated this week. I think this week we had the pharmacists graduating. Previously, the pharmacy program, people were just graduating as pharmacists, but now the program is that they graduate as Doctor of Pharmacy. So we just want to say a big shout out to all those pharmacists that got their doctorate degree in pharmacy today, and to all Liberian doctors that got their specialty last week as well.
Good. Okay. I think Dr. Mulbah, sorry, it was an oversight. I think you might ask a question, tell the public about yourself and your area of specialty, because, then they will know who's talking. Sorry, it was my bad.
So I am David D. Mulbah, a general practitioner, graduated in 2019 from the Dr. College of Medicine. So like as that Allah rather place it, Liberia has only one medical school. So it means that if you want to become a doctor in this country, that is the only option you got. And the school is so unique that you can be dropped out from the school, you can repeat, and so on. So from all of the doctors that attended Dr. before the Ebola, usually the school should be 5 years. For all of the Ebola doctors, we had to stay for additional year, which was, we spent 6 years in med school. And so we are trained to be able to handle day-to-day issues in the health system. So as a general practitioner, I should be able to handle almost all of the cases. One thing we also want to stress is that our school fees, the medical school is absolutely free. So we're giving stipend, though sometimes not regular, but we're giving stipend as medical students. And after your studies, you are to serve the Liberian people because it was their money that was used to train you. So the understanding is that after your training, you should be able to serve for 2 years, which is a compulsory service. 1 year internship, and after the 1 year rural service. In that 1 year, first you will do 6 months of surgical skills acquisitions, because if you are assigned in rural areas, you have to do surgeries. I'm telling you, you have to, because like my facility, sometimes like right now, I'm the only person here right now. My colleagues went for weekend today, so I have to stay and be here. And so basically, you have to be trained to meet up these daily challenges. As a doctor, I'd aspired to be a pediatrician. Like seriously, when I was studying medicine, my intention was not to do surgeries. But when I came in the rural areas, because in Liberia, if you cannot do surgeries in the rural area, the people ask, "What kind of doctor that can do surgery?"
Dr. J, he's scared of blood.
Yeah, what kind of doctor that can do surgery? So you just have to do surgeries in the rural area before you be considered as a doctor. So now a general practitioner, but I'm doing everything. So that is the Mulbah for you, and I'm hoping to do I'm hoping to become a pediatrician.
Okay.
Can I go for my second question then?
Yeah, sure.
Okay. If you like, I'll just roll my second question. Do you hear me, guys?
Yeah.
Yeah, I can hear you.
Yeah, I want to take it to Dr. Mulbah. Sorry, Dr. Lah and to Dr. Mulbah. Yeah, I think you very experienced doctors. I think one time conversation with you, you had the opportunity very unfortunately, but to be in Liberia during the Ebola as well as the COVID, and Dr. Mulbah as well. These epidemics had a serious impact on our healthcare system. I just wanted to share with us what lesson did we learn from this, and how can we prevent these things for the and pandemics that we have, and pox coming again with news coming. You were there, you practically involved in treating people. Just tell me what lesson can we learn from, how can we prevent this with the situational healthcare system we have? I will start with Dr. Lah, then we'll move up to that.
Yeah, thank you very much. And I think that's a very good question to start with. So when the Ebola situation happened in 2014, I was still a third-year medical student. We were supposed to have started clinicals at that time. So the medical school is, when we started medical school, when we did a medical school, it was 2 years of preclinical services, where you have to do all of these big courses. And then by the third year, you move over to the hospital where you begin to see patients under your professors. So unfortunately for us, the Ebola came. But our fourth-year medical students and the fifth-year medical students were already practicing or doing clinical rotations at that time. And we lost some few colleagues there. So to that question, I think when it comes to pandemic situations, no country can run away from it because it is not any country's fault. But what most countries have done is that they do have a good system in place, prepared and ready to face this pandemic when those outbreaks happen. Because I think what we learned from the Ebola is that Ebola caught us pens down. We were not prepared effectively to fight Ebola. But I think the system, I would want to give thumbs up to Dr. Kete. He was called in at that time by President Ellen Johnson Sirleaf, and he came in to set up a system where we were able to meet up the expectation fast and very fast. But before that, a lot of Liberians died from that. And then coming to the coronavirus situation, I think we learned a little bit from the Ebola. But the problem with Liberia is that when we face challenges and we overcome those challenges, we do not leave system in place with the mindset that these challenges will come back again. Because I can tell you, for all of the isolation centers that were set up during Ebola, there was no effective system put in place for those places to be sustained. Or maybe for a specific area to be set up that you can call an isolation center wherein you are prepared for another outbreak. So when coronavirus came again, we were going hectare-scatter looking for means to start up new isolation centers. So I think what the National Public Health Institute is trying to do now, and I think we've got somebody really good in place there, is trying to have a system in place. Pandemics are always part of the health system. They will come. When they do come, you should be prepared for them. So we need specific places that are called isolation centers. They are there regardless of whether or not we have these outbreaks at the moment. So be prepared that when those outbreaks do happen, the system, the ministry is ready to start fighting them effectively, because like Dr. Mulbah rightly said, you do not have many doctors. Losing a single doctor in our health system to any outbreak is a big loss to us. I had the opportunity to work as one of the doctors where you call the Union COVID Center. So I was the second person there in command, and we had a lot of people we treated. I can tell you that one of the biggest challenges in Liberia is education. People would not listen to, they will not believe it. We have superstitions. People wouldn't believe that COVID was there. People wouldn't believe that Ebola was there until they start seeing dead bodies. So I think there is a big tax on us as citizens of the country, as a ministry, to make sure that our people are informed. We have these systems in place where when these things happen, we can be able to effectively start fighting to make sure that we do not lose citizens who we need for development.
Thank you.
I can pick you up?
Yeah, go on.
Okay, so yeah, that a lot. Thanks for those points. I think these are all good points. So one of the things that Ebola did was that it exposed our weaknesses. Ebola showed us where we needed to pay attention. And though we fought Ebola as a country, but Liberia problem, I think, not only in the health sector, has always been maintenance. We can start something good, but then to maintain that good thing, it is a problem. Ebola was the first. From the COVID came, we've already had the experience, though COVID was not deadly as compared to Ebola in Liberia, but we already had the experience. We already got a lot of experienced health workers when it comes to epidemic or pandemic issues. So with fighting COVID, it was kind of a bit easier as compared to Ebola. Now even with the mpox, the monkeypox situation, right now we have like 3 confirmed cases in the country, and I think we've been dealing with that pretty well. So we just need to, and the new DG for Enfield, I think he's gonna do, from what we see from the few months that he spent there, and from his track record, I think he's gonna do well. He was at my facility, I think 2 weeks ago, to come and see, because there is a isolation center that has been set up in Spetember to serve as a hub for nearby towns here, instead of patients going to Ganta to overwhelm Ganta, because there is another isolation center in Tapeta. So the plan is that they should have strategic isolation centers in each of these counties, that when these epidemics or the pandemics, or when there are outbreaks of these conditions, that we can be able to handle them. So when he came, we had lengthy discussion and fruitful one as to how we're going to furnish these, like the isolation center to our place. But again, it is not just about furnishing it; it is how we can be able to maintain it. Because mpox is here today, it might not stay. Maybe another virus or another epidemic disease will come tomorrow. So our problem is maintenance, and how we can be able to keep these areas functional, that we can be ready at all times. That is one of our major challenges.
Cora, you want to answer 2 questions?
Yes.
So before Cora comes in, Cora, let me take a few seconds of your time. Dr. Lah and Dr. Mulbah, I'm here to make this program and this show spice it up. So I'm gonna ask both of you one question, and then I will say something later. Which one of you is currently in Liberia?
Guy, you have your turn.
So I am personally in Liberia, and to be precise, in Spetember in Nima County.
So before Cora go, here's the joke. The man in Liberia is currently having the stable network. The man in the UK, I know which are the internet using.
Oh, well, I don't know.
Okay. My question goes to Dr. Mulbah.
Okay.
In regards to citizen participation as it relates to the healthcare system, what can we do as citizens to help you guys as a doctor or as healthcare practitioner to make the healthcare sector a better one? What is expected of us as citizens? Because as you said earlier, there is not so many doctors in Liberia. So what can we do as citizens to make it easier and to also help improve the healthcare sector?
Thank you, Cora, for that question. So it is not a one cash all. It is not a question that we will say, okay, the citizens, because the citizens got their part, and we the health professionals who also got our part. When it comes to the personnel or the number of staff, I think the government got more part to do with that. This number was even far less than this before the presidency of Madam Ellen Johnson Sirleaf. From Madam Sirleaf time to Ambassador Weir, now to Ambassador Buckeye, the number of doctors to patient ratio, I think, is improving as compared to before. But if we look at the issue about providing service to the citizens and the citizens being open to those services we are providing, we still have a little bit of gap. I will tell you that, especially in the rural areas, we are not the first contact persons when it comes to health. A lot of people, when they get sick, the first thing they want to do is to self-medicate. Someone gets sick, the first thing they want to go to a drugstore to get medicine for days or weeks. If they cannot work, they go to a clinic. If they cannot work, before not coming to us. So in most instances, we do see conditions that are already late. That a lot talk about education. We need public education. We need to educate the citizen on the importance of going to hospital. I was reading a book and the author said that Africans do not go to hospital. Africans are carried to hospital. And actually, it is true. A lot of us willingly, for the men, is even worse as compared to the women. So our first contact is not the health facility. Culture, beliefs, and so many things. So if even we increase the number of doctors, we also need to increase the civil education. We also need to increase the number of persons that we are able to educate on the importance of coming to the hospital. Because I tell you, it is a problem. It is a problem. The trust that the community got in the traditional healers, it is more than within the health system. That is a gap that we need to fight to be able to bridge that gap.
Okay, thank you. Okay,
You're
the
welcome.
next question goes to Dr. Lah. I don't know if I pronounce your name right.
Yeah.
Okay. You have had the chance and the opportunity to go abroad, and you've come in contact with different learning environments. So, what are the difference that you notice between the Liberian doctors and the foreign doctors, and what do you think that we can do as Liberian or the Liberian doctors or Doplati or the medical school system back home can do to improve their quality of healthcare in Liberia?
Well, that's a very brilliant question, and I think there was no better way to put it than how you've put it. So there is one thing common among all doctors, is that we read the same anatomy book, we read the same physiology book, we read the same surgery book. So medicine is something that when you become a doctor in Liberia, the standard should be the same as someone who became a doctor in America. As a matter of fact, I think Dr. is doing really well because I've had the opportunity to interact with foreign doctors who never studied in Liberia. And until I told them I was training Dr. none of them believed it. I work with some plastic surgeons from Spain, and they never believed that I studied at Dr. College of Medicine until I told them. One of my consultants from Australia, when I was doing my pediatric rotation at MSF Hospital, never believed I studied at Dr. College of Medicine. So what am I saying? I think the amount of study we do, and even as a matter of fact, in Dr. we did public health from year 1 all the way to year 5, but I never had a degree in public health. So we are well trained, but I think when it comes to patients-doctor relationship in Liberia, it is really bad. It is something that I have learned. For instance, in the UK, for example, the NHS, the patients own the system. The system is for the citizens. They own it. It is their property. It is not a doctor's property. When you look at the ethics in Liberia, medical ethics is something that we need to work on really, really well. I think those are some of the things. As a doctor, I think I'm speaking this out because when you find weaknesses in a system that is not working, if we want the system in Liberia to work properly, then everyone has got to play their part. So for example, patient confidentiality is not proper in Liberia in the health system. People go to hospitals and their data, personal data, age, their diagnosis will be on Facebook out there. So it's a big issue that it doesn't have to start with the nurses, it has to start with the doctors. Because when a patient walks into you as a doctor, these are people who are going to open up private conversations to you. And the only way, like for example, when I worked at Saklepi Hospital, there was a particular group of patients that came and they wouldn't see me because I wasn't part of a certain group. So there was a specific doctor that he was working with me. He has been part of that group before. So when they came and that doctor wasn't around, they wouldn't see me because that group, he has been part of them before and they know how they keep their secrets. What am I saying? So our citizens in the rural area, confer in that system of tradition where if you've been part of certain group, they are confident in you enough that they can tell you whatever they need to tell you. And if you have never been part of that group, or maybe co-society, let me say it that way to make it more easier for our listening audience in Liberia, they wouldn't come to you. That's the same sacredness of medicine. That's the same way medicine will be sacred. People always ask, why do you think people in Europe, politicians, will have their treatments here? It's not only because the services here are better. It is because their personal data, their diagnosis will be kept confidential. The last time our president went to EAW hospital, then he was campaigning to be a president. It was all on Facebook. Yes, I know he's a public figure. It is right to say the president has gone to EAWA, but all of his diagnosis was there. Every one of you here knew somebody has pacemaker. So people do not confide in a system that their personal information will be exposed that way. And I think that is one of the ethics of medicine in Liberia is at its bare minimum. Liberian doctors, Liberian healthcare professionals, we need to work on that. That is one of the major problems I see. But when it comes to the training, when it comes to the qualifications of Liberian doctors, I can tell you that we are at that level to perform as well as any doctor that is trained outside of Liberia. But the main issue I have seen, and we have to do, is the ethics of medicine. Doctors, healthcare professionals will speak to patients anyway. They will just call you here, do this, do that. Sometimes people come to hospitals. Healthcare professionals are just barely not paying attention to them. It's not everyone, but that is a systemic issue that needs to be fixed because doctors are trained to serve. Doctors are not gods.
Thank you so much. Yes.
We
I'm done
move
with
on
the
to
two
Paul.
questions. Yeah.
So when it comes to the issue about the confidentiality that the law talk about, the thing is, it is a systemic problem. So sometimes it is difficult because the record system that we use, majority of the hospitals, the record system that we use in this country is still paper-based. That is, we see patients who write as doctors, make prescriptions, and then send these charts to registrars. Some of them are non-medical people that need to record these diagnoses, because for every patient that you see, whether the patient was admitted, whether the patient was seen in the OPD, that patient record should be registered in a registry. So that is where some of these issues coming from, because it is possible for me to see a patient. I'm not exposing the patient information to anywhere. I pass this chart over to the registrar, register this patient as well and Z, and the information could be leaked from there. But it is a systemic problem that we need to find a way. Like, we got a special group of people that come to hospital, and the issue about confidentiality when it comes to these people, it is very, very high. Because when these people come to the hospital and they find out that they've been talked to in certain way, they will not want to come to that facility again. And so for that unit, like for instance, the ART unit, in bulk of the facilities in Liberia, you go, you see that the HIV unit is always at the back. So just by the audience seeing you going to that unit, whether you are going there to visit, whether you are going there for something else, the conclusion is that you already got this. So it is something that we're still trying to find out a way. To some facilities, what they are doing now, they put almost all of the chronic conditions in one area. So ART unit, if you have diabetes, you are coming to the hospital maybe for diabetes issues, you go to that unit. If you have hypertension, you want to come to the hospital, you go to that unit. If there is tuberculosis, you go to that unit. The essence is that so that people's mind won't be fixed, that once they see you going to this particular unit, it means that you're having this particular condition. So the confidentiality issue, it is not something that we're just going to sit there and say, oh, okay, this way will work. But it is something that all of us need to find a way. Because even at my place, there was a scenario that I had last year. It was kind of funny. A lady brought her in-law to the hospital, and they have taken her to that unit to do the test. The lady from the unit came to write in a chart. Right after the in-law saw the lady writing in a chart, she went out of proportion. She started to cry. So it created a serious problem, and just by you writing, so we need to find a way. I was in a meeting with some doctors, I think from Malawi and some other areas, and they were telling me when it comes to that particular aspect, those data are locked because it is a computerized stuff. So you cannot access that particular data as a doctor, even when you are seeing the patient. If you should log on to that patient information, that aspect of that information will not be shown to you. If you are maybe a new doctor, unless you are the doctor that be attending to that patient. But in Liberia, it is not the case. Once I pick up your chart, I will read. And another person pick up the chart, they will read. So it is something that sometimes it is difficult. So you will see if someone has that kind of condition in Encyclopedia, they'll prefer to leave from here and go Monrovia and take that treatment. Go to areas that they don't know them. So it's a serious problem.
Okay, gentlemen, time is, I mean, the information is like I'm sitting in a classroom here, I'm just laughing and learning. The time is our enemy, but we'll catch up with it. Paul, move on. So, doctors, I think if you make your answers, brief, we want to cover a lot of things with you guys.
Or else,
or else what we'll do, we might just force you to be with us for a few extra minutes. So we all in it together. Paul.
Okay.
First of all, I will salute the doctors for their hard work in Liberia and
we'll give them some money.
Yeah, and also maybe we can generate some sort of money here to help them. But something came to my attention, Dr. Mulbah. You say you're only 2 doctors in your area that you work, if I heard you correctly.
Yeah, right now we are 3. We are 3 doctors.
3 doctors.
Yes.
And the reason why I asked that question is 3 doctors, and just imagine, all right, Dr. Lah said he's ill, and maybe 2 of the other doctors, one may travel and the other one may car accident, one not there. How do you people manage with the patients? That is the nurses that take charge before somebody return. How you got money with that? Those are the challenges.
So you got to improvise. And
right.
Like I am the medical director for this facility where I am. And I got administrative issues that I got to handle. Sometimes I'm lying there in the night, I'm called, Dad, no current in the hospital.
Wow.
Dad, the other one in the hospital. So I have to attend to it. So when I get to the hospital in the morning first, I got a list of things administratively that I need to handle. Then I go to the second arm, which is the clinical work. So I'm telling you, some days I will not even touch administrative work. I will be on clinicals throughout. Maybe in the night before now I can be able to handle a few things. So like today I was in surgeries and I needed to sign a few checks. Those checks I have to wait until I was done. But some days it is overwhelming. Like where we stay, we got 1 ambulance at this facility. There is no utility vehicle. There is nothing yet. So when I'm called in the middle of the night, if the ambulance have gone for a patient, I have to walk to the facility in the night. And it is dangerous for us. And I think the ministry, we've told them this, and I think that they are working on something like that. But some days it is really challenging. To tell you that we've been doing this is just God. It's just God that have been guiding us through, because like I'm telling you, some days we are really, really overwhelmed, and we just have to do what we can do, because that is the only options we got.
Right. Look, my second question, we know there are a lot of Liberian doctors in the diaspora, and some of them graduated from the same university you graduated from. When they come home, do they help you guys to facilitate some of the work that you people do? And I think maybe Dr. Lah can chip into just to find out if you're getting help from the other doctors around the world that come to Liberia.
With respect to that question, I think. Hello, can you hear me? Hello?
Yeah, your network, Dr. Lah.
Yeah, I don't know what's happening to the network, but well, if you can't hear me, then maybe Dr. Mulbah can be speaking. Let me try to.
Okay, yeah, maybe you can try to reconnect. So yeah, we do have some of our colleagues when they come down, some of them will come and practice maybe for a few weeks, for months and go back. But also know that some of these people take vacation to come and be with families. They've been working over there, and some of them, some doctors leave from here. They are not practicing medicine again because, like in the States and other areas, to practice medicine is not joke. You got series of processes to pass through. And even though few ones that will come back home, maybe for a week or two or for a month, they got so many family pressures on them, family issues, so they are not coming for work again. So now they only pop in to speak, and that's it. So it is not really like they're coming back home to help. We don't see a lot of them like that. Unless maybe someone went for studies, came back after their studies. But to say someone came for vacation and say, okay, I'm coming to commit this time of vacation to work, I'm not seeing it.
Yeah. Hello.
Yeah.
Can you hear me now? Yeah. Yeah. So over the past few months, I've tried. I think I spoke to Jamel about that. I've tried to speak to a few doctors here in Europe. Some are in the UK, especially in Northern Ireland. We've got some doctors there. I've had personal conversations with them, and I just asked them, what was their thought on doctors, because I just literally came from Liberia not too long, but there are doctors in Europe and some part of America that have been there for ages, for years. They are experienced. This person I was speaking to, he was a qualified urologist that has practiced in one of the NHS trusts for almost 15, 20 years. And then he also did breast surgery. He's an oncologist as well. So and then we have some very good gynecologists and things like that. So I asked him, we had a lengthy conversation. I spoke to about, I think, 5 doctors. So I spoke to them about the health issue in Liberia and how doctors in Europe can sometimes maybe speak to their various hospitals to see how they can get some assistance back home to support Liberia. And the interesting thing that I was told was that they've tried to make efforts, and then most of the time, the problem they face is a lot of the doctors in Liberia currently, the things they are doing it out of nothing. They are improvising. When you travel out of Liberia and come and get some training here, and you get to know that some of the things you were doing back home in Liberia, even though people were getting well, quote unquote, may not have been the right procedure. So you come here, basically you got vast amounts of diagnostic materials to use, you got equipments to use, and you get used to that system where the ethics of medicine actually settles in your mind. Then you want to go to a place like maybe Zoge district to do urology surgeries, but these materials are not available. So he told me that I have spoken several times to people back home to see how we can get ourselves together and go and do some of these special kind of surgeries in Liberia. But the responses we get is that we have to bring our own materials. Oh. And then when you are talking about urology surgeries, you need specific kind of tools and things like that. So he told me that if the hospitals or somewhere in the ministry, they can provide a system and set it up where certain things that are common in Liberia that need people from overseas to come and do those materials, those equipments can be provided, then it'll be quite easier for doctors who have transitioned from the system in Liberia to a system where they are used to using specific kind of equipments and tools to do their special kind of work to go back home. So you, the young guys, he told me, he said, like, I'm about to retire. I want to retire home, but I don't want to retire to a system where I do things the wrong way. You understand? So I think, and I told him that was good. We right now at the level of the UK, I think they just ULOC, which is the Union of Liberian Organizations, just had their 26th celebration, and I was at that program. I was able to meet a lot of doctors. And then what we're trying to do now is to see how we can link with all other doctors within the periphery of Europe to see how we can connect and then generate ideas And then when that idea is generated into a written format, we may communicate that to the Liberian government through the Ministry of Health. And then when they are willing, maybe we communicate with JFK that we have these doctors, but these doctors do not want to come and sit in Monrovia. They want to go to the rural areas. Can you provide current? Can you provide generator? Can you provide vehicles? Can you provide accommodation for them to come? These things have to be set up. When this system is not in place, it's difficult for you as an individual doctor to pack your bag from Europe after so many years. Who are you going to in Liberia? So there must be a system in place where we know that this system is there. We communicate with that system. We let them know we have 5 oncologists. We have 5 brain surgeons. They want to come, but they don't want to do surgery moreover. They want to go to Tapeta. They want to do this. Can you provide the necessary materials for their work? They've told me that once that system is in place, they are ready to go back home. Not to go and stay, but to do this 1 or 2 surgeries, this 1 or 2 treatments, and then come back to where they call home. Yeah.
That is a very interesting point. I guess, Paul, your question, was it Paul? Your questions are answered, right?
Yes.
Okay, Guy, we have a situation here. One of our panelists will be leaving because of certain engagements. But I guess we would like to take a shot at the 2 doctors before you leave. So, Guy, I will play with you if you can wave your, not waving it, but if you can get transition, switch around. I remember, you see, Guy, you started eating, so you go to you took Tracy time, little bit of time. So if you just give Francis the chance, then he asks his 2 questions, you'll be leaving, then the rest of us will stay. Even if you want to take my own time to Guy, you can take it. But Francis, we know you'll be leaving.
No way I can disrespect the president. You won't put me in Javate with the president. Mr. President, go ahead.
I wonder. So, Francis, please take a shot at the 2 doctors, and we can hear from them.
Yeah, well, thank you guys. I want to say thanks to the doctors for the level of service they have, provided and continue to provide for our people in Liberia. It's commendable, and we hope that all our young students in Liberia will take the opportunity to venture into the medical field. My questions. I have 2 questions. They are not soft questions. It might be disturbing. It might, but you guys may choose to answer them or not. The first one has to do with a damning report from the U.S. Embassy, the former Ambassador McCarty, in regards to the misappropriation, or I don't want to say corruption, at the Ministry of Health, and it has a trigger now effect on the services that they provided. I mean, drugs were misappropriated, some were squandered into personal use. So, do you guys believe that corruption has some way or other affected the level of service in the healthcare system? I mean, in terms of drugs, adequate pay, salary, wage for our healthcare workers.
Delala, you want to start?
Yeah, so I think the report you're talking about, I read it, and it was at one of the local hospitals. So the way our health system is set up is the Ministry of Health is at the top level. And mind you, most of our health budget comes from donor funding, with USAID being one of those biggest organizations that do fund the UK aid and stuff like that. So they do monitor the funding that they gave to the government of Liberia, and they want proper reporting. We follow that case closely. I don't know whether it's still in court or whether the final report is out. But what I can say to that is the way the system is set up is that you have the Ministry of Health that oversees everything regarding health in Liberia. Then you have the county level, because Liberia obviously is divided into counties. So you have the county health team. Now, when the budget is appropriated to the Ministry of Health, this budget is now reappropriated through the Ministry of Health to various counties based on their catchment population and the amount of hospitals that are there. So, for instance, when I was at Saclipi Comprehensive Hospital, whatever budget that is set for us, it is the medical director who becomes the final say, or he works with the administrator of the hospital to appropriate those money or that finance for a specific aspect of the hospital. So you have to.
Let me tell you that the ambassador was talking about donor funds, budget.
So that's what I'm talking about. So the donor funding that comes, the ministry still appropriate that. So some of the donor funding, they support specific or special kind of programs in some hospitals. Like Saclipi Comprehensive Hospital, we had the ART program that was supported specifically by donor funding. So when that money is sent, that money has to be appropriated specifically for that particular purpose. Now, what the previous U.S. ambassador was referring to was a leaked audio from medical directors that was linking that conversation to this specific funding for it to be appropriated or redirected towards something that wasn't meant for that purpose. So yes, I do agree with you. Corruption is a big issue, not only in the health sector, but in every sector. But for this specific discussion, I can tell you that when it comes to medication, when it comes to pharmaceuticals, when it comes to surgical materials, it comes to running the hospital, it is through the medical director. But again, it is because of lack of system, lack of monitoring that these things happen. Because there are some things that happen. For example, if I wanted to sign for the money that was appropriated for my hospital, it is done through the county health team. Then this proposal goes to the Ministry of Finance. From the Ministry of Finance, that's supposed to sign this document to relieve your funding. Then from that place, it has to now come back to the ministry, to the county health team before your money is appropriated. Before I took over the hospital, I heard that sometimes Saclipi's budget will remain in at the ministry because it was an over budget. What did I learn later on was that, listen, the issue of corruption in Liberia is so complex. Before you get your appropriation as a medical director, you will need to pass through different strata of corruption before you can get that money. And if you do not agree to it, you do not get the funding. I am not justifying this thing, but I am saying this for the system to be set up where these things can be monitored. Because you make a call to the Ministry of Finance that our check is there, this money has been appropriated for the hospital. I do not have surgical materials. I do not have gasoline for surgeries. There is a pregnant woman here. Now, the money used to be given quarterly. Then somebody tells you that you know what to do before I sign. This is the reality in Liberia. If you don't do it, listen, the rule, I think we'll get to the discussion how the health system should be funded. We'll get there later. But the people in the rural areas, they don't care. People have politicized health issues in Liberia to the point that it is not about life anymore. It is about politics. So those people, you do not have medicines in your hospital. They do not realize that you are calling the Ministry of Finance, but your check is not given to you because you have refused as a medical director to give somebody who is supposed to sign that check a tip. And if you don't give that tip, that money remains there. It goes as budget, whatever, over financial people know the terms. So what do you see? People, I'm not specifically speaking to this question, but I'm letting you to know how this whole thing about corruption come about. If you don't want to be corrupt, you are dragged into the corruption by force. Because, like that Mulbah said, you don't have gasoline for the ambulance. The money is released every 3 months from the Ministry of Health. You should get a specific funding. Your budget that was allocated by your lawmakers, you should get it to run your hospital. So you expect that 2 months before you get your money, you've made your appropriation, where the money will be spent on drugs, on things like that. Then you now make your check, you send that check for signing. At the Ministry of Health, at the Finance Ministry, you have to pass through 4 or 5 offices to get that check signed. Those 4 or 5 offices, brother, you cannot come out of those offices with that check unless you agree to some form of corruption, unless you agree to give some of that money to somebody. If you don't do it, that money is not released to you. It is not given to you. Then the report comes out that you never perform as a medical director.
Oh, I see what some tells you talk about.
So no,
the money
now when when that check comes back, then it has to go to the county health team level. We have people who are not medical people there who you have to deal with as well. I will have to say, because as a young person in Liberia, this hurts. There are good people in the system who want things to happen, but nothing good is happening because it is very hard. Like all of you here in Europe, I can tell you for a fact, when you go to the bank in Liberia to withdraw your money, if you do not do what they are asking you to do, you stay in hold, they may not give you that money. If you need that money for something urgent, you just have to comply. That is sometimes the same thing that in the health sector. So there were days that we never got the money from the ministry because some of us refused to follow that trend. And then the next thing is a politician comes to the place there and say, oh, a pregnant woman died because the doctor refused to do a surgery. Doctor refused to do surgery because there was no gas in the generator, because he couldn't get his appropriation. So it is a complex situation for me to sit here as a medical doctor who work actively in a rural area to justify that a specific individual was corrupt. The system is bad. The system is very, very bad. It has to change. It has to change. So we left that system like that. We are hoping that it will change. But this is the reality. And I can tell you that if you go to Tapeta, if you go to Zwedru, if you go to other places, you look at your budget, you sit in America, you sit in Europe, you sit in England, you say, okay, Tapeta Hospital has got 1 million. Why are people still dying from, why is maternal mortality still high? Who told you that 1 million, the medical director is going to get it? If he needs to get that 1 million, about maybe 100,000 of that million will need to pass through places that he needs to soften grounds before he gets his appropriation. So this is how bad the system is. It has to be said. Somebody has to speak about it. And until it is done, I can tell you that it is either between politician A and his group who are no longer in power, using it against politician B who is in power. And when A comes back, the routine goes on. I think that's how much I can speak to that issue. So it's not only with the government's money, it also happens with what? With donor funding.
All right, thank you. Yeah, maybe Dr. Mulbah want to chime in on that, and I'll go to my next question.
Yeah. So you spoke about, you asked question about the then ambassadors report when it comes to program drugs being sold in the market. So we're not going to sit here and say that the health sector is corruption free. The system as a whole is corrupt. I've told people at the ministry on so many occasions, it doesn't make sense, right, that I'm appointed as medical director and I'm not giving anything extra. I take my same salary as a doctor. Like any other doctor, even my resident doctors are all taking the same money. But then I have a budget to control that is far more than my salary. I'm not saying this is a ground for corruption, but there should be something extra, especially where people go into the rural areas. You are giving someone extra responsibilities. You are exposing this person to a lot of funding. There should be a level of compensation for that new role that the person is taking. Donor drugs, for instance, you said and other partners gave this country malaria drugs. I was in a discussion with a few guys that work with the embassy, and the guys were telling me that if even the 5 million persons in Liberia decide to get malaria today, Liberia should have medicine to treat all of them. So I was telling them not possible. The guy was telling me that I am telling you that the medications that we send in this country, if all of you people decide to get malaria today, people should get medicine to treat. We got a system where donors medication, especially from my own facility. The medication must leave from the central medical store, the central medicine store in town. It leaves from there. It comes to the county health team. From county health team before it gets to the facility. I hope you just understanding the trend from one station to the other. So you, Francis, for instance, you are a facility and you are told, oh, Francis, I'm just giving an analogy that you got 10 cartons of anti-malaria drugs here. Sign, you go here, sign, you want to saw 8. So, Francis, you take that 8 now, but on paper, you got 10. So, Francis will say, okay, I don't want to do the work. I don't want to do the paperwork. So, I'm not going to report for 10 while I receive 8. You decide to take your own 1 or 2. So, you see from way up all the way down. So, before it gets to the end users, the story is different.
So until maybe you get 2 cartoons.
so the story is different until we can have a system wherein that if I'm saying, Francis, you are entitled to 10 boxes, I'm going to make sure that you receive the 10 boxes. I mean, you are going to account for them. The reason why sometimes you hear issues about corruption and at the end of the day, it will just, I think, maybe die down some kind of way, because the kind of screens that can be attached to some of those cases, when you dig deeper, you'll get to know that that is a whole cartel. That it is not, because like seriously, some of the reports, when you read it, you be asking yourself whether these reports are real. But then when you talk to inside sources, when they start to disclose any things to you, you just be like, but then we are brave in this country. But the system, we need to work on the system, and we should have people that are sincere. If we can get people in positions that are really, really sincere, I'm telling you, the little resources that we can get, we'll be able to manage and be able to do well. But the system is chronic. For the issues that Lah was talking about, I don't want to go on that side yet because I stay in Liberia. I don't want to go that side. but I think it is I think a bit improved. It is not too bad in this region for the first few months we've seen. The allotment is becoming a bit regular as compared to before. The bureaucracies are not many like before. So we see a bit of light, and we hope that this trend continues. So we know that all of these bureaucracies and so on been there and so on, but it's not like before. That one I can be able to say kudos to the
maybe didn't see that Google here. Francis, you want to take a last question?
Anyway, yeah, guys. Thanks for the answer to my questions. I just want to put you a little joke when Dr. Lah said when he didn't take his money for his clinic or for his wherever his facility, the money went back to the system. And I can remember the last 6 years, I think Samuel 12 was talking about budget surplus. So the money came back. So the money they were talking about. So everything had a budget surplus on that. But anyway, guys, I was a little taken aback when we talk about confidentiality. In the documentation of people's personal data. Well, I live in Sweden, matter of fact, and they have the codes they call right. People go to now as they're not doctors, but they learn from the ethics, being doctors. They call medical secretary. Is that applied? Is it offered at the medical school in Liberia or TNMA or somewhere where You have people who are responsible for recording data and patients' personal data. So they can be specialized in that area. So the government, the health facilities who can be able to gap some of these leakages of personal information and data out there, because there's a training as well. So I just want to know, send it out there for you guys to check it out. Maybe you guys can recommend it to this, to TNIMA or MBW college, something that they can offer a short-term course, 6 months or a year, so that you can have people specialize in recording people data at the hospitals and health facilities around Liberia. So yeah, guys.
I think with that particular aspect, I can tell you that with the medical jurisprudence, and in medical jurisprudence, you are taught the ethics of medicine. The nurses as well, they do medical jurisprudence, they do nursing ethics, and even the PAs, even the nurse aides. So the problem, this course you're talking about, of course, is going to be very useful. But when it comes to managing people personal information like their diagnosis, when you do data management, one of the courses in one of the modules in my master's courses I'm doing, you have data manager, you have the data controller, you have different people that you can hold accountable, and you know from which level the data was leaked. So irrespective of you training people to know how to keep people data secret, if the system is not in place, for example, if Dr. Mulbah took certain data and gave it to me that input this is one of the senator's health file. He was acyclopedic comprehensive. We've treated him. This is his file. Keep it or enter the data. Now, he is managing that data, but he's passed that data to me to control that data. If the system is not put in place from the person who has to manage it, input it, and control it, you can have people who are trained, it is not going to work. Like he told you, we still write in this digital world, we write patient information on papers, on charts. It is not inputted into a computer, it is not logged up, it is not passcoded, and that paper or whatever is passed on to someone else, and before you know it, you're a public figure, you had a herniorrhaphy, or you had some form of surgery, that information, including even your picture, is on the social media. So I think it is not, Liberian problem is not that people do not have the training. One of the biggest problems is that people do not want things to be digitized in Liberia, because when things are digitized, it is going to cut off some of the arms of corruption. So it just has to be open, no record. So when it comes to doctors do medical jurisprudence. Nurses do some. The nurses do it. The PAs do it. But we've got this training. You bring a paper for me to write on, it will not protect your data. After giving me that training, give me a system that can protect all of this information. We will complain and be tired. None of you on the show will want to be a senator, a president, lawmaker, whatever, a minister, and want, if you have cough, the diagnosis and the medication you took be written there. So all of these things are things that we all have to work together as a team, as citizens, as doctors, as medical practitioners to protect in Liberia. And I think a lot of countries are willing to support and help Liberia with systems that can digitize some of these things we're talking about. But Liberians have to also be willing to accept it. I gave you a scenario. 2017 UL entrance, Dr. Jala was in charge. I think it was Dr. Jala, one of those people. So I was one of the people that was this thing by UL to administer that entrance. I think I was posted at one of the biggest high school in Liberia there. So this guy came with a system where he wanted people to go online and register for the entrance. You register for the entrance, you get your ID number, and then you get your certificate. After you get your certificate, you get your ID number, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your certificate, you get your ID number, you get your certificate. After you get your cer and then the day of the entrance, they go into the system, they can see your ID number. You will receive your entrance result through the ID number. If I'm not mistaken, it was 2017. That entrance never took place. You know why? Because going ahead with that kind of system will mean that the legitimate people who have studied for their exams are going to be the ones whose name will come out. Do you know what that would mean? It means thousands and thousands of people. These are not government officials. These are Liberians. And the corruption, when I hear people talking about it, they keep saying government. It starts with every individual Liberian. Because you are not walking to that office to write name down and have your own list of people whose names you will want come out when the entry results come. If this system remains in place where people go and register and computer is bringing their name up that they pass, a lot of people will not get their money. A lot of your friends and family children will not get the admission. You know what happened? On the entrance day, none of those people showed up. None of the offices open. Mother Patin was closer to UL. They were trying to give the UL. They went and hired talks to chase the students out there. Before you know, the entrance paper came out, they say the entrance leaked. Tabajara had to leave Liberia because his life was at stake. So that is how hard and that is how sacred corruption is in our system, that when most of you here will bear witness that you've tried. What are you talking about now? If it is a system that will take money from out of the hands of people who are taking it illegally from the government, they will not support it. They will drive you out of that country. So these are some of the things that we're dealing with at the level of not only the health sector, but in the entire system that we have in Liberia.
Okay, all right. Thanks for the show, guys. I have to leave tomorrow. I'll go push my cartoon, so.
Yeah. But Francis, I think you raised a good point. We must start from somewhere. And the issue about medical secretary, I think it is a new thing because we don't have that yet. Like you already place it that with the doctors we are trained, with the nurses are trained, but then those that are recording the information in those various ledgers, they are not trained. So I think there's a point that we're going to take. I will talk to a few guys, maybe from the LMDC, AM Doctor team. Well, we include there as a course. Instead of us just taking, yes, I think that would be a good starting point while working on the system. Let us have professionals, because if you have a profession as a medical secretary, you will know your code of ethics. Instead of us just taking people that can read and write and bring them as registrars to come and work in the hospital. I think that's a good one.
Yeah, just before I leave, let me just say, because look, there's no system is foul-proof. So they adapted the system in Sweden as well. Those technologies here, but you become a technocrat in a particular field. So your school, your tree, you know what to do. Instead of taking somebody who went to, how you call it, the tapping school intern, long time, no more the tapping school, and kind of say secretary. So guys, we nice seeing you guys. Dr. Lah and the team, Dr. Mulbah, kudos to you guys, and keep fighting, man. We try to do something on this show to help for your clinic to help, you personally, to help you going, so we're talking out in the back and see how best we can reach out to your clinic or your facility in your hospital.
Professor, before you take leave, let me send a message on your behalf, though probably maybe you did not remember that. I heard Dr. Lah talking about collaborating with doctors that he's spoken to in the UK and, the peripheral areas that he could reach with some of the doctors. Here in Europe, there is a Liberian federation that coordinates activities of Liberian associations in Europe. And it's not limited to the United Kingdom as well. So Francis Mensah is the president. Like he said already, you can work in the background. So I'm just connecting you right now to him.
That's very good. Thank you for. I think I had a short chat with him, including the president of the Liberian Association in the UK, and I think both of them are working hard to make sure that Liberians in the diaspora, especially Europe, we begin to do something for the people back home. So it's nice being on the show with you today, Francis and I hope that we can have some chat after the show regarding some of those plans that you have.
Definitely, guys.
Yeah,
Okay.
you can always get any of us. Or I'm the
Secretary General there.
Oh, okay. Then all the big people are here. So yeah, our country actually need you guys. And most of the doctors I spoke to signposted me to the team, to you guys. And we are hoping that in the near future, not too long from now, EFLA, which is the European Federation of Liberian Associations, we can see how best we can do something to help the system back home in Liberia.
Yeah. Very good. You got a whole team. The communication man is there. God, so
I'm ready. Yeah, we're happy to be on the show with you guys.
Okay, guys, man, I have to leave. We'll see you guys.
Okay, Francis, thanks so much for being on the show tonight, and we hope to see you tomorrow as well.
Definitely tomorrow. It'll be tomorrow.
Yeah, tomorrow's show will be interesting, guys. Just in case you're listening to us, we invite you to join us tomorrow. We're going to have a big fish in the net tomorrow, and this one is going to be all political. You know, these are doctors who don't want to do them any disservice by asking them political questions. So the real politician will be here tomorrow, Mandela Cooper. This woman ran to be president, and then finally she supported the rescue train. Now she's working as political advisor, as I understand, to the president. So the show will be fiery tomorrow. Tomorrow we're going to ask her all of the political questions. How is she advising the president? Is she satisfied with some of the things that are happening in the government just in 9 months? But we'll keep it right now like that. Let me lower the tempo right now. So I can flare up before time. But also that will be the show tomorrow. Mandela Cooper will be here as our guest. Same time, 9 o'clock Central European time, 8 o'clock UK time, and 7 o'clock Liberian time. You can join us tomorrow. And we'll have fiery time. Guy, go with your question. And Guy, I'll be on you tonight. Make it short. Now, man, you know what I'm talking.
Okay, guys. Once again, let me say welcome to the two young doctors. As you guys were speaking, right, I was almost thinking if I should leave the position of being a panelist and join you in speaking, because I experienced a lot of the things you experienced because I worked for a few years with medical doctors and nurses during pandemics in Liberia. So I know both the challenges from just facing a pandemic or a medical situation, than having a normal situation and facing corruption as a challenge. So I felt your pains when you were saying them. But I have first two issues. When we were speaking, one of you spoke of the mpox and other pandemics that comes to Africa. Another concern raised while you were speaking as well from my angle was the rural parts of our country, how the people relate with the doctors and nurses there. The question is, over the years, maybe in the last 20 years or 25 years, our medical sector tried to see how we can bring together our former medical practices and doctors with our traditional medical practitioners, which include maybe the informal midwifery and normal, midwifery. Then we come to doctors as well. I don't know if they have traditional doctors that understands medical things, but I know the system has tried to bring them together under one umbrella. The challenges you listed earlier on, do you face challenges with these people as well in working and collaborating together? That's one. The second question is, 80%, I've been following the show both from our radio and Facebook. 80% of the concerns from comments and your own responses you've been giving are almost similar from both sides, from La and Mulbah. And lots of what you require has to do with modern technologies. Example, fighting corruption from Dr. Lach's angle, it has to do with system. And the system can only be in place when it's digitized and it becomes more vivid to the people that when anybody practice corruption, the red mark is there. There's a line, there's a red light blinking. Everybody knows somebody is doing something somewhere. So how do you see the medical sector with the digital system it has now and a medical sector probably in the next 5 years? Because in the next 5 years, Dr. Lah might have been finished with his master, maybe going for a doctor, advanced doctorate degree and something else. How do you see the medical sector in the next 5 years?
Yes. So I don't know. Starting with your first question regarding the monkeypox issue, I think Dr. Mulbah made much emphasis on that. That the system has improved much better. As at now, we've recorded only 3 confirmed cases, and then the National Public Health Institute is for making sure that Liberians believe in the system, they feel protected. So I think people who know what they are doing are actually in charge, and we have to commend them for that. So rest assured, I've been following every issue regarding this outbreak in Liberia. When the head for the National Public Health Institute had his conference confirming the first case, I followed that to the end. So when it comes to pandemic and those kind of issues in Liberia, I think we are getting there. We're not there yet, but we are getting there. Now, the issue with digitizing things in Liberia, for example, I am thinking in the next few months, I will be undertaking a course called Therapeutic Radiography in Oncology. This is using radiography to treat cancer. If you did that and went back to Liberia, what are you going to do? You're going to sit down to fold your hands because you may not have the technology there to use such education you've acquired. Now, when it comes to digitizing things in Liberia, I think in the next 5 years, with the level of education that the youth are getting, with the level of energy they are putting in, with the amount of Liberian youth that are going to school now, whose eyes are beginning to open. Just recently, I felt so proud sitting here looking at young, very young people, more younger than myself, graduating out of the medical school, out of the pharmacy school, some of them having masters. In my mind, as a young Liberian, I know these people will not settle for little or nothing. It is my hope and optimism that they are going to push. The world is digitized now. They are going to push and continue to push as we are pushing as well to make sure that we do not settle for the kind of system we have now. So with this mindset, with this kind of thinking, I believe that in the next 5 years, things are not going to remain as they are because there are more young people who want change in that country called Liberia, and they are not just sat at home wishing that it happened. They are going for it. They are going to school. They are learning. I think now we have 2 neurosurgeons. We had one previously and one just graduated. And these people are not going to come back to Liberia and want to sit down and fold their hands. They will want to work. So obviously, as more people get educated, we are going to go digital. Now, patient records have to be digital in Liberia. One of the conversations I was going to have with your president, and I think the ULOC president is also initiating, is that we need to make sure that we go back home. We cannot sit wherever we are now and make those changes we want in Liberia. We need to go and let these people know how these things work, how it has helped their system, how it has saved them money. You understand it? Because if you have anything that's digitized, it's difficult for things to leak out. It's difficult for government to lose money. And we are hoping that ULOC working with Airfly, we can achieve some of these goals, go back, given the course that the president was talking about. These are things that we will have to go back on ground and speak to the institutions about. So in the next 5 years, I see Liberia far, far ahead of what it is now, because the young Liberian boys and girls are no longer sitting Most of them are in school. Most of them are getting PhD. Most of them are getting masters. And until that system, they cannot work in that system and succeed. So they will have to grab everything with energy and know that if you have got your masters, you are in your 20s, you are in your 30s, and you think you are going to succeed in that country with the system it currently has, it is a big lie. So I'm urging and challenging every one of them that when people leave the diaspora and go with ideas that deal with digitizing things, ideas that deal with keeping money in government coffers, because I was speaking to someone from Liverpool University. They wanted to get information from medical school. So they asked me which medical school. I called my school name. They cannot even, so you call me, what's the website of the school? So when I was there, I know they have a functional website. People literally have their phones in their hand when they're asking you questions. They just want to Google stuff and get information. So they've set up the medical school. The kind of information they need, the medical school does not even have that kind of website to provide that information. You know what they did? They just wrote off my medical school. Meanwhile, we are in a world where you can just call the name of any, even a little classroom in UK here, you'll Google it and find everything. You'll see the name of the departments, you'll see the name of the professors, you'll see the programs they are offering, you'll see tomorrow's schedule on the system. When it is open to everyone know where the corruption will come from. So I feel really hurt. So these are things we need to build on. If you went to the University of Liberia and typed the website, you can get proper information that you need to get from a university. And this is a medical school you're talking about. So I've spoken to a lot of young people back home in Liberia, and I see a lot of energy. I see a lot of determination. And I believe that in the next 5 years from now, there'll be a lot of changes that will surprise every one of us when it comes to digitizing things in Liberia.
Yeah, I don't know whether Dr. Mulbah wants to touch on it briefly, because we have, like you're talking in Europe, yeah, we have versatility of people. People are versatile in different areas. And so we have a young Liberian AI giant. He works for one of the renowned companies in Europe, yeah, or in fact all over the world. But he's based here in Europe. And he's in that IT era, so probably we'll bring him on briefly, just briefly, maybe 2-3 seconds to talk about it. But Dr. Mulbah, if you want to chime in on that question, just 1 minute or so we can move on.
So Cholo play before Dr. Mulbah comes in. Let me leave this last one so that Mulbah can end on all of my questions. I raised this question from Cora's concern, where she was concerned with the doctors and the patients and the community relationship. It's not just the doctor, the patient anymore, but it's the doctor and the patient and the community relationship. Example, you have patient A. Patient A has her uncle, her nieces, her nephews, they become the community. Now, with all of your challenges that we've listed and we've given you questions from, and we are giving you more of those questions. Now, you have a system that is so stiff-necked to feeding on the practice of corruption as the way forward for anything in Liberia. When you have a digital system, how do you school the community to your digitized ideas and knowledge? Because you are only bringing it to the people because you have the idea to come forth to them. How can they be schooled to that as well, so that the system, because like example here, when we faced the epidemic in Germany, people could work from home. But while you work from home also, they had system to even monitor the number of patients or maybe number of people in the house with fever for the day. You have apps, you have different kinds of technology that you could just upload all of your information from home, and the government is already understanding that, okay, Augustus and his family are safe today. You know, XYZ are okay today. So let me understand your idea. It may come back to you, or you could take it on, Dr. La, and then before Mulbah takes on. So let me understand from you, what are your own ideas presenting? Because now you're not only presenting it just as medical doctors, it has to pass through the rank and files of government, the same government that has all these different forms of systemic corruption. How do you get away with this?
So okay, let me first, you asked a question about whether there was any marriage between maybe the traditional healers, maybe the TTM and so on. So there have been a marriage between our traditional midwives and that of the health facilities. Right now in Liberia, TTMs are not allowed to do deliveries at home. If you are caught, you'll be penalized severely. To even make it more better, every TTM got a catchment community. So everyone that will leave from that your community to come to the hospital, you are compensated. So I'm told the amount in Liberian dollars is around like maybe 2,500 for deliveries that the TTM is given. So that has helped to reduce even maternal mortality and the level of home deliveries. The issue about technology, we need to be strategic and focus on where we want to start. I think right now our first step within in the next 5 years should be, let us try, if we are tackling health, let us try to make all of our health facilities or all of our hospitals records should be digitized. The ministry started something right now. I think it's been there for some years, out of 1 or 2 years, I can't remember, but my hospital just got enrolled into that system. At first, we have to submit hard copies of all of the transactions that we do with government money. Now, there is a system that is digitized. The hospital is enrolled onto this system that before I can do any transaction, somebody can just say to the ministry and see that the Mulbah has signed a check to this vendor and the vendor has withdrew this money from the Mulbah's hospital's account. So that system is working perfectly. I don't have to be in NIMBA before I can approve a particular transaction. So we are in the process. If we are able to control our home, which is the hospital setting, then now we can be able to now control the other aspect that you were talking about, us being able to monitor the community, we'll be able to monitor maybe the patients and so on. But if we say we want to do all at once, it will fail. So for me, if you had to ask me if Liberia want to make really progress, let us focus right now on all of our hospitals and set a target that within the next 5 to 10 years, our goal is that there will be no paper-based record in any of the public hospitals in Liberia. If we are able to achieve that, we must train personnel, we must train doctors, we must train everyone. If we are able to do that, we can now graduate from the hospital level and get to the community level and start to teach the communities on basic signs and symptoms of some of these common conditions. Like right now, Plain Liberia got people in the field that go and treat community members, go and test children under 5 for malaria. If you are positive of the RDT, they treat and so on. It has helped to reduce the positivity of malaria for the under 5 and bulk of the rural areas that we have around here. So for me, what I want to say, let us start first with a smaller unit, which is a facility, and then move on to the community. But within the next 5 years, if we want to achieve that, we must be determined. The thing I see in this country, we are good at talking, but when it comes to implementation, we are weak.
Yeah, that's right.
So if we want to do this, we should be serious about it. It shouldn't be politically driven. But if we're not serious, even in the next 10 years, I'm telling you, we'll not be able to achieve anything. If our leaders are actually serious about this, that they want to achieve this particular thing, not just by saying it, by heart, we can be able to achieve it within the next 5 years. I can tell you, there are people willing. I have seen people in this country, all the way this country is, there are records out there bad. But I have seen people in this country that are committed. They want to see the right things be done. We just need to create that channel through which these people can be able to explore their sincerity. Thank you.
You muted, Linfo.
Dr. Lah, you want to chime in just a second, and then we can.
Oh, I think Dr. Mulbah has said it all, and obviously, it will have to be every department, every sector, because if you digitize things in Liberia, for example, and hospitals do not have currents, no computer work when there will be when there is no current. So obviously, I think some of the challenges, those are some of the obstacles to these things, because it's just going to be a failed attempt on arrival if you have somebody that can set up a very functional system, but you don't have internet connectivity, you don't have current, and computers are off. So basically, if these things can be provided, I think the issue of digitizing things, like I think you were speaking of a Liberian. I don't know whether it's Thomas, the one you've added.
Yeah.
There are a lot of people, other people too, that I know that are into complex computer profession in the UK here, and they keep asking these questions. But some of the things they will tell you is, do you have good internet connectivity in Liberia? Do you have current? You understand? So I think there are some basic things that just needs to be fixed, and these people are ready to go set up this system and monitor them.
Okay. The trend of the conversation switched, and it switched for the right purpose. That is, the digitalization of documents. Because take for example, Dr. Mulbah, you were way there somewhere in rural Liberia in Nima, and all of a sudden fire breaks out on there. You got all of the, God forbid, you got all of the people's document, their data, everything on sheets of papers in your office, and fire breaks out, all gone. Tomorrow the same person can say, "Oh, but man, why you been here before?" Because I'm sure you can't remember everybody. You see it? So it's very dangerous. It's very dangerous for the entire nation. Okay, but we'll bring in Thomas. Thomas, welcome again. This is not your first time. Thomas is almost like a regular mayor, when it comes to digital stuff. Thomas works in Belgium. He's a computer analyst or computers. Someone that may you trouble yourself, but Thomas, we're discussing this digital thing, bringing the medical system in Liberia. At least we're dealing with medical people today, right? The medical system, digitalizing the records. Do you think it's possible?
Thank you so much. Guys, can you hear me?
Yeah, sure.
Yeah. Thank you so much for the conversation. Firstly, I want to congratulate the two doctors for educating us on the topic today about doctoring. I am not a doctor, but I am a computer doctor. So the question that you ask, yes, it is possible. And how is it achievable? How is it going to be implemented? That's separate things. That's 2, 3, 4, 5 different things. So I heard the brother talking about internet facility. Now, there are you have intranet and you have internet. They both operate on different level. When you talk about internet, then you want to have access to someone's computers outside your remote environment or outside your current environment. But if you want to deal with intranet base, it's going to be a bunch of computer system or data systems working together in one sync collaboration, but in the same environment or under the same network. So if if we are scared to implement this issue because of internet, where it is more achievable on intranet, because all health sector in Europe, all of the science sectors, all of them work on intranet. So you have the IoT, you have the Internet of Things, but you have OT as well, which is Operation Network. All hospitals, you can also Google that in England, all hospitals in Europe, all around the world, their network is Operation Network, which is OT. The reason that is for OT, when you go to the hospitals, you see when a patient needs something, they press a button, and then directly it signal that particular that particular nurse, and then they come in running. These things doesn't need to communicate on the internet. It all local base, so it's running on an OT. So yes, we can implement such a system in Liberia. Now coming to the digitalization about records. It is good that we're having this conversation, because if we don't have this conversation, we will not know what we want to implement, or we will not actually understand the problems that we face. I was kind of lost in the topic before when the beginning of the conversation, but then literally it just switched, because technology and health, it works hand by hand. You understand? The two things never separate themselves. So how are we going to implement it? There's a data management systems regarding to health record, where we can create or systems that a patient can have full access. So it comes with a 7 level. So you have the patient side, which is completely digital. You have the doctor side, the side, the administrative side of the program, where you have all of these 7 pillars working together. So going all the way down to securities that are going to be working in the hospital, coming to payroll, and all of that is simultaneously implemented. This system can be run in Liberia. The only difficult thing that we heard on this platform is electricity, because running 3 to 4, 5 servers on a one building, it's a lot of energy. But we cover that. We solve those problems by using solar energy. Solar energy can solve a lot of problems. And if you have almost about 30 solar panel on top of your hospitals, your IT equipment can run simultaneously on those 32 panel. The only way that we would need internet, which of course it is needed, that is to sync data from one hospital to another. For example, if Bomi County, the certain patient want to come to Monrovia, and then they want to transfer that patient there because they don't have the equipment, that data can be synced simultaneously. Then we need internet for the two data systems to sync. Then when the patient arrives to Monrovia, the doctor don't have to go through all this of the paperwork to register, because the patient have a unique a number which is attached to that person's name. So with that unique number, that person can go all over the country and have a medical care, and then that system will actually shows the record of medical facility that person has been having. You understand?
Yeah.
So yes,
okay.
It is.
But Thomas, you will continue, please. I'm not interrupting, but let me it just popped to me. You're talking about this kind of setup, where you can use both intranet, which is the smallest version of the internet stuff, local version, and the internet itself. And one other area people always think about is the internet thing. So how costly you think it will cost to set up these things? For instance, local hospital in Ganta, Dredu, or somewhere outside. How costly you think it will cost?
I am not good in cost. Or I'm not too good in cost, but I will actually leave that, because if we want to go through cost, then I think we should be able to consult with Gemma, because I'm also board of director when it comes to the Liberian entrepreneurs and professionals in diaspora. So the cost of building such a program, we already have the people and the know-how and the feasibility to be able to build those systems. So with that being said, we've already take away the building of that type of system in Liberia. Now, the equipment that those system is going to run on is what we need to facilitate. That is the servers. Maybe we need a UPS. Maybe we need a router. We need different kind of IoT systems that will communicate to each other, because you don't want your patient, you don't want your nurse to be working with headset. I mean, on Facebook. No, you're going to lock all Facebook activities, but only the medical application that is particular on that mobile that the health worker can use. So with cost, we're only going to look at the equipment, but not not building the system, because we already have people on the ground.
Yeah, and you know the reason why I asked about the cost. Sometimes when our Liberian government, people in power, when they hear all of this, they say, "Oh, but I think that big money people talking about." You know, sometimes they don't know that it's achievable, especially like you, like what you say, we got the people who can build the system, but only the equipment will buy. But when our people hear the whole thing, they say, I think the way our system been working, I think it's better. We not put our hand that kind of thing, you know, with the corrupting, you know, the corruption thing going on. But guys,
yeah, the money is there. The thing is, it's just that we don't have the willpower to do it. If one senator can write $80,000 car, this
they don't want to release it to you. They don't want to release it to people.
Hold on. You just talk about a data center or a solar system. $80,000 can put a good solar system in a hospital that the brother is working in. And to be honest, what all required that $80,000 spent on one vehicle can think about a 103 lawmakers cut their cars. That can happen in Liberia. We can have a better health system with all of the equipment.
Yes, sir. That is achievable. But one of the things that I've been running a lot of data and analysis on since the beginning of the project in Liberia is the biometric system. Now, implementing such a system, we should be able to merge the existing records with the biometric system with such a system. But I don't know if it is achievable or it's really, I don't know yet if they're going to allow us to do that whole, because it comes to, privacy and data privacy and all of those attachment to it. But one of the things that posited on this system is there are two places that you go to give your data, which is accurate in Liberia, and that is hospital. People give their data, correct data, because they are in need, so they have to give the accurate data. The second point where people give their data correctly is schools, because you don't want to give false name, because when you graduate, that name is going to be on your certificate. You understand? So this is the two key point that we should be able to target. How can we get the data within the system? The system is just there, but it's waiting to be functional when there is data into it, and that data is only citizen records and what have you.
Okay, Thomas, let me ask this quickly, right? Initially, you spoke of the two different kinds of system, or three basically, right? The internet and the intranet. So since it's more simpler in working with the intranet than the internet, is it possible, like Dr. La is doing now, he's talking to colleagues and doctors, to see if they can get back to Liberia and do some things. Is it possible from our own angle to work with them and see how we can work with hospitals there, like in Dr. Mulbah's place, like maybe somewhere in Bon County, in Hendy, and other places, that at least we can start with maybe 10 facilities first and see, because they will already have internet access, right? So it's only to access a system that intranet can be possible. Like example, if Thomas is leaving Grand Cape Park County in J, and you're going all the way to Bon County, and you need to access medical information from there. And so into their medical system, the nurses will ask you for your hospital cards and everything. But if the intranet can access those things, because they're just communities apart, Liberia isn't that big, so if you have it set up, they can work with it and it can look more advanced, even close to the OPS system. So
Yes.
is it possible that we can run that?
Yes, and when you come to when you talk about the intranet, I think the intranet system, that is the reason that all medical facility around the world is built upon intranet. One have to do with the data and security, because you don't want to have your patient records online where I'm an IT guy, all right? So I can close all ports on the firewall, and I know every hacker, the 0 day, all of these things, the intruder, I know everything. But they got some guys that were brilliant and were trained especially to be able to hack medical record. But if the system is running on an intranet because um, if you have an internet, you bring your system to the wall. You understand? And when you have an intranet, you minimize your system indoor in your country. So the hacker will be from internal, not external, if you have a leakage of a data. So yes, it is well possible for us to start with a minimal equipment when it comes to just implementing the system in one hospital. But we need to do training. Training is highly recommended because you want to have both patients. Patient needs the most important thing. The most important training comes from the patient, how the patient can trust the system of giving their data, trusting the doctor. Because I hear one of our brothers saying that, if the village people, the villagers are not used to you, they don't give you that trust. You understand? That's a good one because I'm just hearing that. But how can we build a trust so that these patients, our citizens, our brothers and sisters, will give their data and will trust us? Is to publish our system, is to make it, we have to brand it out there. And I'm talking of this because of experience. I have been working on my project, on my private project. I've been working on a drone project to deliver medical facility to a rural area. And I hopefully that project will be completed in March of 2025, when I will get the equipment. But all of that is to just give back to our people. So we can start with that, implementing data's on a lower scales before maximizing it to another counties.
So
Okay.
can I just come in because I think I'll soon be leaving
Yeah.
to just ask Thomas.
The show is just about over.
Yes. So okay, Thomas, I want to say thanks for the points, and I think they are very much educative. So my initial question had already been answered because I was thinking that with this issue about the system you're talking about, it is all or none. That is, if we want to start it, we must include almost all the facilities, or it will not be effective. But you already answered that. So I think it is a good point that you're raising, because I'm telling you that we have issues wherein a patient will come today, and you do see that patient after 2-3 weeks. When the patient comes to the hospital, the charts cannot be found. You can't find any record of that patient. So new charts will have to be given to the patients. So you have duplication of patient numbers. Some patients will come, cards are missing. At the end, you have to give another card. So you have one patient, maybe sometimes having 3-4 different patient numbers. So at my place, I've been thinking, I think after this show, I have to get a contact for us to talk. I've been thinking whether if there is any possibility in a kind of minimum way that we can be able to keep patient records, even if their cards are missing. When you come to the hospital and you just call maybe any of your names, who can just enter into the system and say, okay, you were here last time and we saw you, we diagnosed you of malaria, we gave you something like that. All of them don't have to be on the internet. Maybe a part of the system could be offline. You could be able to do it manually, and maybe some part of it could also be with the intranet or the operational network. So I have been thinking on how to do that. With you on the show, I think
Great.
you'll be able to help me with that.
Yes, sir. The type of system I'm talking about comes in a 3 platform or maybe perhaps more. But the part that we're going to be focusing on is more about the client side and the operational side, which is the client side is going to be mobile platform. So if a new patient is registered in the app in the system, right, it comes with a mobile. So that patient can register the information or download the mobile apps and use the mobile apps. So at times you will need the medical card, but if the patient forgot their medical card, if they have mobile, they can still log into the mobile and see their records. And trust me, we want to go further that if a patient is using the apps, the patient can actually see what type of drugs they have taken like 2-3 years back, what type of medication, which type of doctor that treated them. You understand that they can go to a different location of the county of the country and say, look, I'm in the system, and then this is the medical, this is the drug I've been taking, this is my doctor, and all of this information can be pop up on the apps. So implementing the system, we don't need to have, we will solve that problem gradually. I mean, slowly. You will not have to think about that again. That will be something of the past.
Okay, thank you.
Okay, Dr. Mulbah, 1 second, please. I got one question. We're wrapping on, I will finish. But I want to forget it, but it's still coming back. You both spoke about, you, especially Dr. Mulbah, where you talk about, for instance, if 10 cartons of certain penicillin is allocated to your hospital before you finish moving from where the warehouse and come all the way to you, maybe only 2 or 3 will come. Now, in Europe, especially Norway, where I live, most of the drugs are prescribed at the hospital, and then they give all the prescription to go and get it from the drugstore. So do you think setting up a central drugstore, maybe by government, okay, that when you see your patient, you give a prescription, that is the drug, it's not coming to the individual doctor or nurse or anybody. They get people out there, the same record system we're talking about, they know how many, government knows exactly how many cartons they send to that particular place. They can do inventory every year. So if you people start writing prescription that I will go and get my drug from that particular central drugstore instead of going to anybody, you think that will work to cut down that stuff, that bureaucracy?
So I don't know how it works on that side, but then it means that especially for patients that will be admitted, right? So if you see patients that are admitted, you have to treat them in a hospital. So it means that the government will send drugs to 2 different locations. One to the central medicine store and another one to the hospital. The bureaucracy is that once the patient leaving from the hospital to that central medicine store, there will be so many things that will happen. Those in the central medicine store, will they be allowed to sell the drugs or will be given the drugs free of charge? Can you also just open the central medicine store in the hospital instead of you having it to different location?
Yeah, actually,
so that the patient come and just get all of the service to one place.
Yeah.
Dr. Mulbah, let me simplify a little bit for Linford, right? What works here? Europe has one system. It just maybe they could be using a lesser form in Norway, a different form in Germany, but when you look at everything, Belgium, Netherlands, all the same, right? Like here, as you're saying it, here in Germany, when I have headache, I'm not going to the central hospital, like in Tapeta. No. If I have severe headache, I'm also not going to the central hospital in Tapeta. That's a no. I will have to either meet the house doctor in our term here. Every catchment area has a specific house doctor. If it's 200 people or it's 1,000, you have a house doctor. So for these little things and symptoms, you get to him at first. In my own case, out of 5 years ago, I did an eye operation. It took 9 months period for my house doctor and a clinic to work on studying what the cost was before I could even go see the proper eye hospital. So now to the issue of drugs. With all these small things, my shoulder hurts and these things hurts. The initial discussion we had when Francis recommended that there should be people specialized in data processing that we can school them. That's how it comes about here. At almost every house doctor little clinic he has or she has, there are different kind of therapists that works there. Maybe they're not assigned there daily because they may not have that sufficient patient based on what they do. But you have them assigned to these little house doctors, as well as to the big hospital. They have their schedules to work in. So for the medication, like your recommendation, it works here as well. You have it in the clinic and you have it at the pharmacies that are outside. So when I have something common, the fear that you just presented, the fear of maybe your patient collapsing in the time interval or leaving the hospital to that place. That's why you will not need to go to the major hospital with these common things. It's being settled in a shorter space and in a closer range. Major issues goes to the hospital. The doctors there will not leave you to go get the drugs outside to that other pharmacy. No. You get the drugs there. When you are well, you are discharged, and then you have your prescriptions for further medication with you. Then you can get to that other pharmacy now. Lastly, to close it up, it is also digitized. When you're leaving with your prescriptions, you're taking it to the pharmacy, you have your health insurance card. That card carries your diagnosis. Something I wanted to bring, I did not bring. In the medical terms here, one of the fears or some of the fears, both of you explain on the data issues. I don't know how to do it in Liberia. Don't you have some coding languages that you use in the medical field? Because here, if you get tuberculosis, they will not write it on your paper, tuberculosis. Nobody plucking data going to see your tuberculosis, bro. It's in terms and in short codes. I learned that thing because I spent almost a year in the hospital for my eye.
So
the date HIV test on me, if they did not tell me, I wouldn't have known they had done HIV test. Because everything was coded. I like paper, so I kept requesting for every document. But everything are coded. They have to explain it to you before you understand it. So don't you people have?
So we got codes, but then Liberia is a kind of small community. So like for instance, if you are going to do HIV tests, every hospital got their own codes. Like in my place, we call it spot, right? But then with time, the nurses get to know what is spot. The cleaners get to know what is spot. Before you know, it becomes yeah. So every time you change your code, people getting to know the codes. The fact that the state paper based and so on, we do have codes for low conditions, but just that keeping the code secret now is a problem.
I know.
Yeah, it's a big challenge.
Yeah, well, guys, Paul, I don't know if you guys have anything, but I just want us to wrap it up now because we've gone far above our time. We don't want to keep the gentleman, especially Dr. Lah. I mean, he's alone there. I hope you get patient to them, man. You got to respond back.
Dr. Mulbah, Dr. Mulbah, did you work for PCR?
No.
So before there was one of the major issue that I think Jamal and I spoke about that probably hasn't been raised is the issue of the free service and free health service in Liberia. Yeah, and I wouldn't want us to forget that.
That is a long topic, right? Because if
Yeah,
we
so
bring that up,
yeah, I know, but it was one of the major thing that he was about,
General,
and
I'm
then
not stopping you, guys. Chima, all the panelists here. Can we have an agreement with the two professionals for us to have them, because there is a lot of things. Myself, I imagine everybody will get me
Even
one
from the
round.
comment section, Linford, from the comment sections I'm following, there are people requesting the topic again and the doctors again.
Yeah,
so it makes sense that we can bring them back.
I think we can, gentlemen. Some of you guys are saying, I mean,
yeah, so maybe if it's a long topic like my colleague has suggested, it's something that from what I have experienced and seen, that it's a model that's working here, but people will say maybe because that Europe so it's easier. It's working other African countries based on the case study that I was given to do. And I think that that model is working in developing countries. Sometimes I try as much as possible. My professors try that we try to use developing countries as the case study when you are comparing different issues. You can't be comparing everything about UK and America to Liberia. We are a developing country. So when it comes to the funding of healthcare in Liberia, one of the things that Jamal and I spoke about lengthily before you come in is the free healthcare in Liberia really free? You understand it? So if we do not have time, we can look for time. If I have a free time, I think I'll communicate to him, and then we can discuss that. Because on my part, as a person who was training Liberia, I worked there. I work with the people. I tell you, it is a lot of work for the doctors. There were days that I went home with no pay because people come to the hospital, they're expecting free service, but you need to make sure that you fetch out money from your pocket to do certain things. Babies come, they don't have oxygen. You can be a doctor, you see a child dying without oxygen, you need to improvise, you need to pay for it. So when I was there, when I worked as the medical director in the rural area, there was a system I kept pushing. I proposed that. I work with the local chiefs. I work with the market women, the Muslim community, the Christian community, the youth, and I try to educate them that, listen, it is clear. Nobody have to sugarcoat this. If we want change in Liberia, we need to embrace it with a lot of sacrifices. The free service we're talking about, I personally noticed it was never free on the part of the patients. And I think it was exploiting them more than if the government has a system in place where if it is 1 cent that the government pronounces for a piece of paracetamol, it will be 1 cent the whole of Liberia. That when you leave your house, you come in, you are going to be issued paracetamol, you have to give a cent to support the government. Most of the people I had conversation with in this UK who are British citizens, when I told them we have complete free service in Liberia, the first question I got, who is funding it? Where is the money coming from? So,
it's expensive.
yes. So I want us to have that conversation, because when you leave, and this is a big political issue in Liberia, and I will want Liberians to take their health as their personal property and be the one to begin that discussion. If we leave it with the politicians, they are going to use it to win elections, and your health will be at stake. So I'm hoping that conversation can be something that we can have, because
we definitely
you leave your house with the mindset that you're going to get free healthcare. But before you do 1 or 2 things here that is not going to government or going to people's pocket, you would have drained yourself out of cash. That if government had a system that they set a baseline, let's say they set a baseline, there are certain things in Liberia is absolutely free, which I congratulate our international partners for, like Certain all under 5 cases obviously have to be free. Pregnancy issues have to be free. But when you set a baseline that, you know what, for certain services, you need to pay a minimum of $1. Speaking in terms of US dollar, people are aware of it. When they come and they pay $1.50, they know that they have paid extra. They can report that as corruption. But if that system is not in place, nurses are setting medications, PAs are setting medications, this is setting medication. At the end of the day, before the patient come and leave, they pay huge sum of money, but still we say we have free service.
Doctor to selling medication? You only calling the other people down the area. You won't leave your doctor.
I will say this for free on your show. You understanding me? The people who suffer this most are the doctors. All the years I practiced in Liberia, not to stay on the doctor's side. It was hard for me to see a doctor take paracetamol to go and sell. You know why? The outcome of every patient you see in a rural area matters to you as a doctor.
Yeah.
When the patient comes, no, it is not. I don't think it is unlawful for doctors to have clinic. Even in Europe or America, you got people who have their private clinics. This is far different from what I'm talking about.
That we host these guys again, these doctors again.
So I think the issue about doctors having clinic.
There's a long topic. I think the
doctor in the clinic here for me.
I think Dr. La wants to expand on it more. Jamal, you are muted. Is it possible, guys, if we gave 25 minutes for Dr. La and Dr. Mulbah to give some details on it?
No, it's too much.
Mulbah work all day. He's not very tired. So let the condition.
Listen, guys, Paul, thank you. I want to say thank you to all the doctors for coming. I'm very close to Dr. La, and we talked a lot. And I want to say a big thank you. Dr. La, we will find a time to have you here as well as Dr. Mulbah and other doctors. And also have our brother Thomas here as well. He's an IT specialist on the medical information system. So we can be able to work on this and also discuss this. So this next time we're going to have a time frame, not more than 1 hour, 30 minutes. So we're going to do that. And I want to take this time, if your leaflet can take us around to make a closing point, so we can thank the doctors and all the guests and for all those who join us for listening tonight. Thank you.
Yeah, because I swear every time they talk.
Therefore, let's go on. You can't go in now. We're not finishing this thing. We need to end this thing right now. Yeah, it's no time to discuss. Take a long story on this. We've been 2 hours, 30 minutes.
Dr. Mulbah, thank you so much. Dr. La, thank you so much. You guys have schooled us. The last time I ever talked to a real doctor, explaining some of these things was when I had Dr. Dr. Andrew Mwana from Sierra Leone. He was my biology teacher in Hayward Mission. So that's the last time I ever had somebody talking to me like this. Here, I'm going to go to the hospital. They do my medical and I go home. But you guys have done exceptionally well. When we read from the comment section, everybody is saying that you guys should come by again. So then we can expand on some of these things and maybe we'll select some real medical issues and you guys can explain some of the common things that our people suffer from. You guys can expand on it. And the good thing about it is that both of you have been on the ground. You have worked there, and Dr. Mulbah is there working. And while you are here, you've been there. You've been not only there, but you've been at the top there. So we'll definitely have you guys. I'll lead that with Chima and Paul, and then they will arrange it, and then we can have you guys on another time. So I want to say thank you guys, and Thomas. We hope you will be ready at all times, because the guys, people will be calling you, man. The Liberian government might even want to get in contact with you. So we are getting there. It will take time. Somebody said it will be gradual, but we'll surely get there. And we all wish the best for our country. So, Paul, Chima, Guy.
Thank you very much.
I think we can ask Dr. Mulbah to make some recommendation, because what happened, people follow this program and people in higher places too may find interest in it. So if some sort of recommendation before you leave regarding the challenge, it will be good before you leave. Yeah.
So, firstly, I want to say thanks for having me here today to Bottom Liberia. This is my first time. I didn't even know that a show like this exists. And with the discussion, the interaction.
Now you know. Hear the news, bro. Now you know. Hear the news.
I will. I will be I think an ambassador for this this show. The knowledge shared here tonight has been great. We learn a lot from everyone. I always told people I want to be part of the change because I tell you I have not traveled a lot, but when you go other countries and once you say you're from Liberia, you got burden of proof over your head. Even when people that have not even school equal to you, they start to look down upon you until you can prove that you know something. So that burden of proof, we want to show people that there are better things and good things can come from Liberia. And when it comes to the challenges and recommendations, I think we've talked a lot here tonight. We need to focus on things that matters. I think in this country we have so many challenges to the extent that our leaders, their focus become diffused. Because of politics and all of things, they're not very focused on major issues. And if we want to attack these issues, we should be real. We shouldn't just say things, but we should be real and we should be determined to doing them. So I want to stop here. Recommendation, let us try to improve the health sector. Let us digitize some of the things that we've said. Let us increase the livelihood of those that are serving in the health sector. I'm encyclopedia. I do not have a home here. I have to get my own place. I have to do almost everything on my own. So at least if I'm being assigned to rural areas or doctors or health workers being assigned, there should be some level of immunities or there should be some level of service that will attract people to go to the rural areas. I'm telling you, sending you to the rural area is almost like a punishment or like you are going to sacrifice. So with this kind of discussion, we can just hope that things improve. I'm really, really happy to be here tonight, and I look forward to us having this discussion more and more for the betterment of our country. Thank you.
Okay. So, Dr. Lah, you want to wrap up?
Yeah, I just want to thank every one of you for hosting us. And I think it was a good show. A lot of things came out tonight. I want to thank Thomas for coming on the show tonight. I just want all of us to be that ambassador of change that we are preaching. We shouldn't preach this and not do it. So my appeal, and I'm glad that I'm on this platform with the European Federation of Liberians. And I'm hoping that all of us can come together as Liberians in the diaspora. I know we will want to beat hard on our government, we want to do this and that, but if we can come together as people who have had the opportunity to come out of here and see some things that are working properly for people, it is bound upon us as Liberians with all of the diverse knowledge we've acquired out of Liberia. So once in a while, go back and do that. And I'm really glad that EFLA has started that conversation with their counterpart here in the UK. I'm hoping that the conversation we've also started privately with other doctors and people here can go forth. So if you are one of the listening audience and you out there, you in Europe, you anywhere in Europe, please rest assured that we'll be coming to you. Some of you have worked for so long in some hospitals, they have trust in you. So we are hoping that you can work with EFLA and other organizations in countries that are in Europe that Liberians are part of, to see how we can engage maybe hospitals that you've worked in for some equipments. I think some time ago they needed some endoscopic materials for one of the hospitals in Liberia, and the doctors reached out to me that, can you reach out to doctors in the UK there and see how Liberian doctors. So some of these things are the things that EFLA is going to be coming to your door mouth for. Thomas, I know they asked you about the course, and you said you didn't know much about course, but you know, EFLA is Liberians. I think most of the things we'll be asking and seeking for, we will not be coming with physical cash. We will just need people to willingly dedicate their manpower to the team so that we can go back on ground. For me, I'm here. I'm hopeful that the work we've started will continue. And if you're a doctor serving in a rural area, congratulations to you. We're proud of you. It doesn't matter what you go through. When you go home every night, just know that you've saved a life. I was in that situation before, and I was very, very content that I took up that challenge to go in a rural area and to serve our people, because regardless of where they are, wherever diseases are, doctors have to be there, and your presence there is making some changes. So thank you to you people. We look forward to hopefully another show in the future.
Okay, very quickly, we'll be bringing you back. You'll go. I don't know, we'll bring you back here.
Before we go, there's a couple of comments you got to tell the doctors. Just congratulatory messages for listeners. Just 2, 3 for them. Justin Lah.
I can't really hear you.
Oh, I said that's. Do you hear me now?
Jamal wants you to put up some of the comments from the comment section.
Said there's a comment coming up from one Justin Lah. I'm so proud of you guys. One Justin Lah could be a relation to Dr. Lah, and another one saying there'll just come a few comments you can put across before they leave.
Yeah, okay. Justin Lah say he's proud of you. He's proud of us guys, and then Cynthia Kamara say thank you, Doctor. There's a lot of comments there. There's a lot of comments there.
NS is also the chairperson of the Make Our Children Safe Again Liberia. He's the one that gave up something doing these MPOX promotion awareness in Liberia. This is a message for you as well. He said, thank you to Doctor for this show. So he's also would like to work with you guys seriously. He talked to me the last time. You want to speak to the doctors as well to work with you in Liberia. So there are a lot of recommendations coming. There are a lot of suggestions. So we'd like to see the doctors back. Dr. Lah, thank you for the effort bringing Dr. Mulbah on. You have been a very special guy. So thank you, sir.
Thank you very much.
Okay.
Thank you.
So we like to say that's how
we leave now.
Yeah. So I want to say a big thank you and to leave with a special Liberian song to make your day quiet. I know it's something to be a tough talking and nice talking about Liberia.
Yeah, but Jamal, before you bring this song, we want to tell the listening public or the viewing public about tomorrow's program. Tomorrow is going to be a big one. It will be political tomorrow. They want no data business there. They want also your data can listen tomorrow, but they want your living or a political thing here. Tomorrow, Mandela Kubo here. She ran to be president. What is she? I won. Would Liberia be better off? All these questions will be coming up tomorrow. So please join us tomorrow, same time. If you're in Liberia, 7 o'clock in the evening. If you're in Europe, Central Europe, it will be 9 o'clock. And if you're in the UK, it will be 8 o'clock. And we'll be here in full to bring you the information.
And if you're in America, it will be 3 p.m. there.
Yeah, but it depends where in America. East Coast.
New York, the New York area.
Okay, that's the East Coast. So you can join us tomorrow for a very lively show with Madam Mandela Kupo. She's the political advisor to the president of the Republic of Liberia and former presidential candidate. It's going to be interesting. So guys, take on some Jamal with your song that you talk about. Yeah. What happened?
So now you making everybody wanna know what do you do for your lady?